Welcome back to Clinically Clear, guys. Today we'll be covering a few important tree markers when it comes to diseases of external nose. There's not a lot of big topics, no main topics, just a few tree markers. Short video. I've tried to put it in the form of an answer with 3 or 4 points for each topic, so it shouldn't take much. It shouldn't take long. So let's get started. First is saddle nose. See, saddle nose. Basically, what is a saddle? What they keep on the horseback to sit on, right? So this is like a saddle. So saddle nose, what is the reason for saddle nose? Because of depression of the dorsum. This is the dorsum of the nose, it gets depressed. And there's also supratip depression. See, this is the tip of the nose. Okay. Now, above the tip of the nose, you have the supratip area. That also gets depressed. And the dorsum also gets depressed. That is the reason for saddle nose. Etiology, it can be trauma to the nose. It can be any septal abscess that causes necrosis of the septal cartilage. There's an abscess in the septal aspect, there's an infection, there's a bilateral infection on both sides of the septum, there's a swelling, there's pus, so that can cause necrosis of the septal cartilage, and therefore the support to the dorsum is gone, so depression. And also as a complication of submucosal resection, when we do SMR surgery, submucosal resection, we remove a lot of the septal cartilage and the bone. We only leave behind a small strut of cartilage just at the dorsum. So if let's say that support is not enough, it can lead to dorsal depression and lead to saddle nose. So how will you treat it? Rhinoplasty, augmentation rhinoplasty, where you will fill the dorsum with any bone, any cartilage, or any synthetic implant like silicone, so that once again it gives a structure. And always remember, this bone transplant, cartilage transplant, autologous is preferred over getting the graft tissue from any other person. You always prefer it to receive it from the same individual. So that is the treatment. So saddle nose, what is it? Supratip depression and dorsum depression. It could be because of trauma, because of septal abscess, or it can be because of complication of submucosal resection surgery. How will you treat it? Augmentation rhinoplasty. You will fill the dorsum with bone, cartilage, or any synthetic silicone implant, etc. And then next topic is tumors of external nose, just the classification. So you have just list a few congenital tumors like encephalocele, meningoencephalocele, glioma, dermoid cyst, etc. Then you have a few benign tumors like rhinophyma, neurofibroma, etc. And you have a few malignant tumors like squamous cell carcinoma and basal cell carcinoma. Squamous cell carcinoma and basal cell carcinoma. So tumors of external nose, congenital, you have encephalocele, meningoencephalocele, glioma, dermoid cyst, etc. Benign, you have a few like rhinophyma, neurofibroma, malignant, squamous cell carcinoma, basal cell carcinoma. Easy 3 marks. Next, coming to rhinophyma. Now, what is rhinophyma? Rhinophyma is a slow growing benign tumor due to hypertrophy of the sebaceous glands, the oil glands at the tip of the nose. As you can see here, at the tip of the nose, and not exactly at the tip, basically all over the nose, mostly at the tip, the hypertrophy of the sebaceous glands leads to a slow growing benign mass. What are the symptoms? Think about it. It is growing, so it can first of all cosmetic intolerance. It doesn't look good, it doesn't appear nice. And if it is a very bulky mass, then it can even obstruct breathing. If it is a very bulky mass, if you see severe rhinophyma, it can be a huge fungating mass, then it can obstruct vision, it can obstruct breathing. So this is the symptoms. Treatment, you can either cut it down using a sharp knife or some lasers or something like that. You can cut it down and then you can allow it to re-epithelialize. You just allow the skin to heal again. Or you can completely excise, complete excision, and then follow it up with skin grafting. That is another method of treatment. So rhinophyma, slow growing benign tumor of the slow growing benign tumor due to hypertrophy of the sebaceous glands at the tip of the nose. Symptoms, cosmetic intolerance, obstructs vision, obstructs breathing. Treatment, either cut it down using a knife and allow it to heal again, or completely remove it and then follow it up with skin grafting. Next, come to furunculosis, furuncles, boils, etc. This is an acute infection of the hair follicle. As we know, in the nasal vestibule, you have nasal vibrissae. What are they? Basically hair. So the acute infection of the follicles of these hair is furuncles or boils. It is caused by Staphylococcus aureus. Risk factors is digging of the nose, plucking of the hair, These are all some risk factors because it causes injury there, right? Symptoms are, as I said, it is an acute infection of the hair follicle. So you'll have a red, tender swelling at the vestibule, red, warm, painful vestibular lesions. Red, warm, painful vestibular lesions. It can rupture sometimes. How will you treat it? Symptomatic treatment through warm compresses. You will give analgesics, painkillers to reduce pain. You can give antibiotics, both systemic as well as topical. Antibiotics for Staphylococcus aureus. You can even do incision and drainage if it is a large, if it is a very, very large furuncle or a boil with a lot of pus, you can do incision and drainage. This is the treatment. So what is the complication? If you leave it untreated, it can lead to septal abscess. Septal abscess, I told there are two causes. Either a septal hematoma gets infected secondarily, or the furuncle or boil which left untreated gets larger and larger and becomes a septal abscess. So what is furuncle or boil? Acute infection of the hair follicle. Staph aureus is the causative organism. Risk factor is hair plucking and nose picking. Symptoms are painful red swelling at the painful red lesions, painful warm red lesions at the vestibule, and it can rupture. If you leave it untreated, the furuncular boil can lead to septal abscess. Treatment is warm compresses, analgesics, antibiotics, and incision and drainage if required. That is about furuncles or boils. And then coming to vestibulitis. Vestibulitis, see, vestibulitis, name sounds like as if it is just inflammation of vestibule. It can, what basically it is dermatitis of vestibular skin. Vestibule is lined by what? Skin. So the inflammation of the skin of the vestibule is vestibulitis. Once again, the causative organism is Staphylococcus aureus. Here the risk factor is slightly different. Because of nasal discharge, this nasal discharge can be because of sinusitis, rhinitis, allergic rhinitis, some nasal polyp, or any cause of nasal obstruction, that can all lead to nasal discharge. So along with this nasal discharge, handkerchief trauma. What is handkerchief trauma? Basically, because of the continuous discharge, patient keeps using handkerchiefs and keeps rubbing the nose. If they do it vigorously again and again, that can cause trauma at the region of vestibule. So this nasal discharge and handkerchief trauma together can, if infected, this trauma, because of the discharge and the trauma, if there's any infection of the skin there, it can lead to vestibulitis. Vestibulitis can be both acute as well as chronic. Acute vestibulitis, you have red, painful, swollen vestibular skin. Whereas chronic vestibulitis, you have crusted, fissured, indurated vestibular skin. How will you treat it? First, you will clean the vestibular area. You will clean the mucus crust using hydrogen peroxide dipped cotton. You will first clean all the mucus crust out. Then what you'll do, you'll give antibiotic steroid ointment. When you give antibiotic steroid ointment, patient initially feels that, oh, he's gotten much better. But with vestibulitis, you have to give a prolonged course. You have to continue it even for a few days after feeling better to prevent relapse. Very, very important. The antibiotic steroid ointment for a significant duration, you have to continue. So vestibulitis, the dermatitis of the vestibular skin due to Staph aureus. Risk factors are nasal discharge because of rhinitis, etc., along with handkerchief trauma. Acute meaning you'll have acute inflammatory signs like red, swollen, tender vestibular skin. Chronic meaning you'll have more of fissuring, crusting, and induration of the skin. How will you treat it? First, you'll remove all the crusts using a hydrogen peroxide dipped cotton, and then you'll give antibiotic steroid ointment to eliminate the infection, but you should give it for a prolonged duration to prevent relapse. That is it, a short video about diseases of external nose. I hope you guys enjoyed it. Thank you for watching.